Hi everyone, I'm Dr. Ridhima Shetty, aka your friendly neighborhood OBGYN. Today I'm here to talk about a really simple topic. So a lot of young girls and women that I know of are petrified of visiting a gynecologist because of having had some past bad experiences. But not all gynac visits have to be unpleasant. Today I'm here to walk you through everything that happens at a regular gynac appointment. Shall we begin? So step 1, it's all about your history. So when you first walk in, your gynecologist is going to ask you a few questions regarding your age, regarding what present complaints you have, whether your menstrual cycles are regular and your general menstrual history, whether you're sexually active, and whether you've ever conceived or had a full-term pregnancy in the past. Step 2 is your general examination, which includes recording your height and weight, checking your pulse, your BP, your temperature, and other vital signs, and then also using the stethoscope to hear your chest for your cardiac and respiratory system, and palpating, that is feeling your breasts to see for any abnormal lumps or masses. Step 3 is your systemic examination. You will be asked to lie down and your abdomen or your belly will be felt for any abnormal lumps or masses or any other pain or tenderness. After that, if you're sexually active, then your gynac will recommend an internal examination. So this is where the dreaded part begins. Internal examination has two parts, the first of which is the speculum examination. What we do is we insert a steel instrument known as a speculum into your vagina to better visualize your cervix and your vagina. This is the part that women say is the most uncomfortable, and I have to agree to that. So the only way for you to get through this and feel slightly better during this procedure is to stay relaxed, to stay calm, and engage in small talk with your gynac so that you'll remain distracted. Remember that the speculum examination doesn't take anything more than 2 minutes. During your speculum examination, your gynac might also decide to do a pap smear, which is a screening procedure for cervical cancer. After the cervical examination comes your bimanual examination, which literally means 2 hands. But don't worry, it's not as scary as it sounds. The scary part is now over. In the bimanual examination, your gynac will be inserting 2 fingers into your vagina and use her other hand to feel in your abdomen to assess the size of your uterus and the status of your ovaries and your fallopian tubes. This process is not going to take anything more than 1.5 minutes at max. All your difficult work is now done. Step 4 is for your gynecologist to prescribe you whatever medications and whatever tests need to be done and explain your condition to you. More often than not, you'll find that the result of this visit turned out to be a completely normal uterus and healthy functioning ovaries. So there's nothing to worry about. So remember, it's just 4 minutes of unpleasantness, which can be further eased out for you if you have a gynecologist that you feel comfortable talking to and one who is aligned with all of your concerns. So just remember that none of this examination can happen without your consent and without ensuring that you're absolutely comfortable throughout the process. So there's absolutely nothing to worry about. I hope this video has been helpful in dispelling your fears regarding gynecologists, and you definitely should book your next appointment if it's due. Ta-da!